Zayed, thank you so much for joining me. I'm excited to talk with you, especially because it's always great to hear from the folks that I work with every day, but I don't really get into your mind and see how you see things. So I'm really excited to talk with you about how you view this world of AI from your perspective. Can we start with you introducing yourself and telling us who you are, what you do at Writer?
So I'm the healthcare industry leader writer. Thank you so much for hosting me here, Alora. I've loved listening to the podcast, and I think it's exciting to get a chance to tell a little bit of my story and to be part of the corpus and community here. So as healthcare industry lead for Writer, I lead our healthcare and life sciences activity. And I came to this role in a little bit of a roundabout way. So I'm trained as an emergency physician. I spent, the first parts of my career taking care of patients in an academic emergency department. And after a couple of years, realized it just felt like a hamster wheel. And I wanted to do something that was going to be able to have an impact on a bigger picture level, and then left a full-time academic emergency medicine about 6 years ago to build in tech. I spent some time in telemedicine, some time in value-based care. But around 2 years ago, I discovered generative AI. I was working for a value-based care organization. We were having wraparound tech-enabled services to take care of people who had really complex medical and psychiatric problems. And I started building some generative AI solutions for our own care teams. And I was just blown away. Like, this was unlike any of the technology that I'd seen before. And I felt I need to do this not as a side part of something else. This needs to be front and center for me. This is not a side of the desk type of thing. So I went looking around for where can I really build the best things that are going to get used by people at scale, and then was able to reconnect with May Habib. I'd known her since college, and I sent her a message saying, "Hey, I'm getting into the space. I can see writers doing great things. I just want to chat." And little did I know at that time that Writer had done just enough healthcare in the latter part of 2023 to know two things. One was a great fit for the company and the technology, but they would need to have a specific type of team and approach in order to do healthcare. It's different, it's scary, it's dangerous, you can actually hurt people. And so I was a healthcare person looking for a platform. They were a platform looking for a healthcare person, and we took it from there.
Well, thank you. And I'm astounded every day by the stuff that comes up out of your team to see what kind of solutions y'all come up with. I'm going to take a step back because I love to just kind of go all the way to the beginning of you, Zayed, of what made you want to even work as a doctor in healthcare to begin with.
It was one of the few professions where you get to work with your hands, you get to work with people, and you get to do something that, and you get to really use your brain. There wasn't really anything else where I could really interact with people, do something that I thought was really helpful and intellectually engaging, and actually be able to use my hands and have a physical component to the job. So I loved the ability to do all three, and to know at the end of the day what I was creating was more than just, it was, sometimes there were some PowerPoint, sometimes there were some slides in some Excel, but you could see that there was a human being, like a group of people that you'd actually been able to help, and I loved it.
And you said you started experimenting with generative AI. Can you tell a little bit more about what kind of solution that you were working on that kind of blew you away to begin with?
At that time, I was running the clinical program for a value-based healthcare company called Firsthand, and our patients had some of the most complex combinations of medical and psychiatric issues in and out of the hospital and the ER all the time, seeing a ton of different doctors, but none of them for very long, supposed to be taking a ton of different medications. And one of the things that our nurse practitioners had to do at the beginning of getting to know these patients was to do an intake. And they had so much going on. They had so many different medical records from hospitalization and on so many different meds that it was overwhelming to process all of that information. And so I started building some very small apps to see, can we use generative AI to process this information and to make it easier, and to make what would be, to do it really well. Like, each patient would take you 6 hours worth
Mhm.
of work to really process everything that was going on, and the medications and the interactions, and this is right for them. And can we make that possible? And I was impressed. The answer was yes. The answers that we were getting, and again, this was I'm not very technical. This was very basic stuff that I was able to put together, but it was able to function at the level of like a second year resident, not good enough to just trust it and say accept, but good enough that for someone who knew how to read it and use it could save an enormous amount of time. And it was doing two things. It was A, saving time that people were spending, and B, doing a bunch of things that they should have been doing, but no one ever got around to because they didn't have the time.
And I mean, that speaks to a larger theme of the trends in healthcare and what makes AI just crucial to creating solutions within this industry. Can you speak to that a little bit more? Like, what are the big driving factors?
I mean, healthcare is huge, and it is like the biggest part of the US's GDP, and in many ways, when you look the healthcare system of any place, it's actually it is the purest expression of their like social contract and belief. What do they spend money on? What do they care about? Who is worth what? Where? What kind of services and people and drugs do you want to fund? So, like going in like what's at the root of it is like way more than we can handle on this podcast or a whole series of them. But like when I look at what's going on in healthcare today, like doctors aren't happy, patients aren't happy, the government and the companies like nobody's happy with what's going on today. And most of the reasons why there's some parts of it that have to do with like what do we fund and how do we fund it, and those are huge political questions that like technology can't help. Those are societal decisions. But there's a lot of that where really smart people are forced to do really dumb work, and that's at every place. That is the doctors, the nurses, and patients themselves. Patients have to like navigating the healthcare system and figuring out just its administrative burden and process is absolutely overwhelming. And so when I look at what are the things that we're trying to build at Writer, I don't think that fundamentally people are unhappy with their health and healthcare and the healthcare system because we're getting a lot of bad like diagnoses are going wrong or people are getting bad care because people are making bad decisions. But it's much more that people are just overwhelmed by all the scut work they have to do as doctors or patients, and what's left over for what healthcare is really supposed to be is like a collaboration between like doctors, patients, and technology on how to make people better. There's not much time or money left for that when we're done with the paperwork.
Can you talk me through, I when I work with y'all, I take a look at these solution maps and they map out, certain workflows and things. Can you talk me through a day-to-day workflow for somebody that really is just in pain or overwhelmed with all of this paperwork and where AI can augment it without, we could take an entire hour for that, but just kind of a high level.
There are so many places, and usually what we're where we're starting is with the smallest part of somebody's biggest problem and saying where is there a whole workflow that would be transformed. We don't start with the whole thing because it's too much to manage and understand, but we start with particular areas. So one of the things that we're doing for Cirrus MD, for example, we're helping their doctors with decision support for benefit navigation. So for Cirrus MD, it's a telemedicine company, and one of the things that their doctors are supposed to be doing is connecting patients to services. So helping them get to know if they have some kind of a medical or clinical problem, they're often eligible for what is digital physical therapy or mental health or employees. There's other stuff that they're eligible that can help them with that. But how do you know? How do you find it? There's a PDF or a binder or some search program, but no one ever uses it because it takes forever. And so what we have done is put like at the point of care this decision support navigator that looks at the interaction that the doctor and the patient are having and is able to retrieve in real time. Okay, this person they've got this medical problem, they've got this eligibility in their benefit set, and can wind up like feeding that up like seamlessly. So there's no searching, there's nothing that's out of the workflow. The doctors love it, the patients get better care, and the payers or the employers who are sponsoring it, like they're paying for all of these resources because they want people to use them, and we're seeing
Mhm.
like triple the utilization or baseline from this kind of a tool. Another tool that we're using is for case managers. where nurses have, again, a little like we were doing it firsthand, hundreds of pages of medical records around a patient that they're supposed to be managing, from emergency department discharge records and operative notes and all their medication lists. And it is torture for RNs and NPs to be going through these huge stacks for what really matters for the particular use case could fit on a page or two. And so we're able to, at very high volume, do that like grunt work of extracting just what matters for a case out of a huge chunk of medical information, so that those nurses can focus on what they are uniquely trained and able to do, is like think about medicine, make decisions, and communicate with people about what's going on.
What are some misperceptions that you're encountering as you're talking with these healthcare client customers about AI that you've had to overcome?
I would say people are very it's that it's dangerous and that it's risky, and I think that there are high risk applications and there are low risk applications of AI in healthcare. I think people have a tendency of just putting everything in the high risk bucket and say this is too scary, let's not do it, or let's just wait. The really good organizations are the ones who are able to take a deep breath and really look at all the scaled workflows where people are doing things, and figure out where is there high value and low risk together, and to be able to like be thoughtful and differentiating about where are there use cases where, even in the worst possible situation, there's no way we could cause real human harm or wind up on the front page of the New York Times, or wind up breaking a law. And you start there, and as you get better and better and better at those things that are lower risk, you develop the capacities and understanding of how to work with AI that allow you to really address the harder but and riskier, but even more high value use cases. On the opposite side is that it's just like push a button magic, and that you're going to be replacing people. For some people, that's really exciting because it helps their budgets. For some people, that's really scary because it's their livelihood. Whether people like or don't like the idea of like push button replace a human, like it's both wrong. Most of the use cases and AI applications that we work with in healthcare and life sciences, there has to be a human in the loop. And so, and not just a human in the loop, but their job has to be easier to do the job with AI than without it. And so this is something that's coming up actually with a lot of the stuff that we're doing with medical writing, with pharma companies, and writing reimbursement dossiers, really long, complex medical scientific documents. They're getting anywhere from 10 to hundreds of pages. It's not that hard to build an agent that writes a paper or a dossier that's 80 to 90 some percent accurate off the cuff. However, that's not remotely good enough. It's we're like, this is an industry that is Six Sigma oriented. It really has to be right. So there has to be a human, and so we're finding that you build you're building two applications for everything that you do that's important. You build one that's like generating materials. There's one that's a writer, and then there's another that's a checker. There's another that is a tool for the human that's in the loop to be able to go back and check all the references and the data, and to do what would be a very like drudgerous QA task like seamlessly. If you just do one without the other, you're not actually able to do something that's transformative. You've got to do both.
Any surprises or unexpected outcomes that you've encountered as people are adopting AI?
I maybe I shouldn't have been surprised by this, but it's how much harder the change in organization management is than the technology. So much of the work is around workflow mapping, change management, and when I think about what's a use case, like what's the right place for an institution to get started, some of the conversation is around where is the technology capable of doing something that's really useful. That's not that hard to have. Like you can read the McKinsey and the BCG reports, and that's the easy part. The harder part is like where is that organization in its ability to make change for something to be meaningful. If people are just doing the same job but with generative AI on top of it, it's kind of helpful, but it's not really helpful. The first level that you get at is individuals actually change their job descriptions, their rules, move from being writers to editors, and that is in and of itself hard. And then following that is changing the relationships within an organization, not just the roles of the individuals, but the way like medical affairs interacts with the commercial division or of an organization, or the way that legal and regulatory interface. Those interorganizational changes are where I think the biggest opportunities are, but I see very few enterprises being at the level where they're able to like address those meaningfully. That like just getting people like within their silos to make change is more than enough of a challenge for now, and that the cross silo collaboration that takes really strong like executive CEO level sponsorship and push to be able to do, which is not as common as I wish it was.
Yeah, that was my follow up question. Is like, what do you wish that they would know going into this that would get them just ready to overcome these silos?
Generative AI is and AI agents are like the internal combustion engine or the internet. They are going to change just about every part of work, but it's going to be the change is going to be bigger and slower than people think that they're going to be. You may be able to get a little bit by fighting it in the short term and slowing things down, because there are all kinds of ways that you can slow the process of change in an organization. But it is fundamentally inevitable that this transformation is coming, and people have to ask themselves, either as individuals and as organizations, do they want to take an abundance mindset and say this is going to make everything better and I need to figure out how, or a scarcity mindset like I need to avoid change for as long as possible? And then the people who have that abundance mindset and say like, how can I use this change to maximize what's good for me, my people, my company, my organization, are going to succeed. And the people who have a scarcity mindset, or I just like let's wait and see mindset, are going to wind up being left behind.
Any examples of interactions with companies with that abundance mindset? What does that look like when it happens?
It is thinking with the end in mind, where like transformation is always the goal. You can't start there, because like this is a different technology. It's different performance characteristics than anything that we're used to before. So all of your old like risk management tools and your heuristics don't work anymore. So you do need to be cautious when you're getting started with something that just doesn't work the same way other things work. The weak place to say, I'm going to start small and then see what I want to do that's small after that. The great place to say, I got a big vision. How do I take the first step towards that big vision? And the ones who start with that vision in mind, they're just able to like, even if the first starting step was the same between the both of them, the ones who've got a bigger vision know where they're marching towards. They do the first thing and the next thing and the next thing and the next thing, and they keep improving. Whereas people who approach it from an organization that approach it from a point of fear will do something, and then they'll, even if it goes great, they'll spend another 6 months to a year processing it and figuring out, oh, but now what? Because there's no bigger vision that they're moving towards.
You've spent the past couple of years, nobody had this figured out a couple of years ago, right? This wasn't just, okay, this is how we do it. I'm curious how your perspective has evolved over the past couple of years on this AI in healthcare, but also AI as an enterprise transformation.
It's made me try to be like more big picture thoughtful about like what does the industry really need, like what are our bigger picture strategic objectives. Like there's no AI strategy and strategy, there's just what's your strategy in AI and how can AI help you with that. So when I look at like what we're doing for healthcare organizations, really like where is the administrative burden, like where is just the gross scut work that's getting between like doctors and patients and good care, and trying to figure out how can we automate it as much as possible. When I look at like pharma and life sciences, it's looking at like what's going on in the world. Like where is there change? What's happening in pharma right now is that pharma companies, there are winds of change. There are forces from governments and insurance companies who are saying that we're not going to pay as much as we've been paying before. So there's a squeeze on margin, and there's also just amazing science going on, like the ability to do gene therapy to like really cure what had been like lifelong chronic disease. Like it is as close to magic as anything that I could imagine. But the magic of that science has a whole set of repercussions in terms of what does that mean in terms of like the business pressure facing the industry. Like you're trying to find, we have a bunch of these amazing like magical cures and treatments, whether it's for cancer or spinal muscular atrophy or sickle cell. But as opposed to either to earlier diseases, like we don't have them for everybody. We've got them for like a growing number of like little individual patient populations, which means there was, like when the first interaction I had with pharma, it was all about, statins and antidepressants, and it's medications where they work okay, but they're useful for huge chunks of the population. So it's very broad distribution, and the science isn't all that complicated. Now we've moved on to like through multiple stages where for these very specific targeted groups, what they can do is miraculous, but you got to find those patients and find the specific doctors who are prescribing and treating those diseases, because not everybody can manage it. Like these are very subspecialized, complicated treatments. Being able to find both of those people and then educate them and walk them through a very complex, both administrative and medical decision making process to figure out like, how do we use these magic drugs, and thinking about like this is the problem that the industry has to solve today at a high level, and then how do we apply generative AI towards it, and it's perfect for it. That level of customization, deep thinking, like scouring all kinds of data sources to find the right doctors and patients. It's the kind of thing that if you had a million interns, you would do it that way, but you don't. So the industry have never been able to be as thorough as they wanted to be, but now you can. Now you can do things the right way because of the technology.
That's mind blowing as far as the just the how you can accelerate toward a cure or a treatment in a way that has never been done before. Are you noticing that patient expectations in just caregiving in general is changing, or do you anticipate that to be changing as a result of this?
I don't think we changed yet, but I think it's coming. I mean, patients, and I'll step back with this a little bit to like my own clinical practice when I still see patients in the ER. Google is a terrible doctor. People would Google things and try to find information on general search, and it's awful. Generative AI tools, they're not good enough to trust on their own, but they're not bad either. Whether it's Gemini or Ask Writer or ChatGPT, you can get a lot of useful information and help from them. So I think patients are getting empowered by these tools are pretty good. They're not good enough to replace your doctor, but they're enough to for people to expect like a much higher level of bespoke explanation about what's going on, and they can see what the tools are being able to do themselves. But right now we have a disconnect. Right now we have a disconnect between patients are doing this stuff themselves, and it's good, but not quite good enough for a real like life altering medical decision. But what they're getting from the healthcare system is the way that it was done a decade or more ago. And so this realization of there's such a gap between what the technology could do and what the system is actually offering you is becoming starker and starker. And what we are looking for at Writer is the organizations that have the courage to not find ways of saying no, but find ways of saying yes. There are all kinds of reasons why there has to be like guardrails and safety, and why it can't work the same way as it does in an unregulated industry, but that you actually can make things a lot better for everyone by leveraging the technology.
And speaking of which, you mentioned guardrails. How about balancing, AI with patient privacy and security? Can you share a story where you've had to balance those benefits between the two?
I think privacy and security it's actually an easy one. I think it's way overblown. It's no different from any other technology. Like when you go to a hospital or when someone goes into a clinical trial, there are a dozen institutions between the cloud service provider, the electronic medical record, the like clinical trial registry software, the case management software, like that personal data is passing through a ton of different places. And for the most part, we're pretty good at securing it and using generative AI with it, so long as you have the right. You just have to make a commitment to doing the right thing. That you don't train on individual patient. You don't train on identifiable patient data. You don't use data for things that is not intended for. But I think the generative AI conversation and the health technology conversation, they're not particularly. different so long as you're committed to like doing the right thing by the patient. It gets talked about a lot. We have to kind of go through the hoops to making sure there's data security. I don't find it to be very different from any other place where there's technology in healthcare.
And it's interesting because a couple years ago, that was like when, I've been working for Writer for a couple years, and privacy and security was like the hot button thing to talk about when it came to generative AI and what you were feeding these LLMs through your prompts and everything. And now it does feel like that's cooled off a little bit more.
There's a ton of ways of doing it wrong. If you put your patient data into like public chat GPT, you shouldn't be doing that because that's going to get trained upon. Like there's no security in transit. Like there are definitely ways of doing it wrong, but they're usually done by individuals or very small organizations operating without guardrails. I find when it comes to an enterprise, that tends to not be where like they've got that covered.
What about like if we're looking at the next decade? Uh, can you paint a picture of what you're envisioning in this landscape of where AI is going in healthcare?
It just makes everything a little bit more joyous and simpler. There's so many barriers that exist between doctors and patients and the medicines that people need. In this like ideal future world, it's really easy for doctors to know everything they need to know about the medications they have to prescribe and about what their patients need, and for patients to know what doctor to go to. That this world of searching through this sea of information and then doing a bunch of really mindless administrative tasks along the way, like the machines take care of that. So we go back to like what medicine was supposed to be, of people making great treatments, people prescribing them, and people using them with as little like red tape in between as possible. And there's still a ton of administrative work being done, but it's not being done by people anymore.
Are you still practicing?
Yes.
How do you think it's going to make you a better doctor?
The small way and like the futuristic way is it will help in like making rare diagnoses, but they're rare, and the things that like me and my colleagues just plain miss are not that common. The real impact is it's going to like let me be way more present with my patients, to see more people and to be much more present and engaged with them, because I'm not spending my time and mental effort on documentation and on and information search. I'm spending them on like on real medicine.
I want to kind of get to the heart of this because you talked about how, you became a doctor because this was kind of like this full self, right? It demands that you bring your full self to patient care or to diagnosing. It's just like your full brain, you get to use
Mm.
your hands. And I'm getting the sense that through this conversation that all of this administrative burden is pulling you from that that sense of self as a doctor.
Medicine, like almost every other field, has gone through. 50 years ago, everything was analog, and it was kind of slow, and there wasn't great technology. And then we said, okay, technology, we're going to transform everything. It's turned us all into screen monkeys, and whatever our job was supposed to be as creatives, doctors, like engineers, like we've all just become screen monkeys. And we can go back to getting all the benefits that we're getting out of this screen time without the actual misery of the screen time.
Yeah. I saw a meme on Instagram the other day that was basically like everybody's job right now is just pushing buttons in some way. It's either pushing the buttons on your keyboard or swiping on phones, it's and it seems like this technology is going to be pushing the buttons for us so we can get back to that human connection a little bit more or get back to our creativity a little bit more.
That's the dream. I think it's going to take us a while to get there. There's so much, and there's so much just inertia in the way that things are right now. There's so many, companies, institutions that make a lot of money from the way they are right now. So it's going to take us a little while to get there, but I'm optimistic about the future, even if it's probably a little bit further away than I like it to be.
And what advice would you give your past self before you entered this whole generative AI era?
I would just say, just be curious. This is an opportunity to, every time a new technology comes along, there's an opportunity to, question a lot of assumptions and to say, like, why are we doing this? Why? And usually, like medicine and and healthcare and like pharmaceutical science, they're very traditional organizations for reasons. Because if you screw something up or you change something and you didn't know what you read, you could actually do some real harm. And so there is wisdom in those unarticulated whys of why do we do something, because we always have, because the way we always did it was safe and effective. But when you have a technologic inflection point, a lot of those old whys aren't relevant in the same way anymore. And so there's an opportunity just to keep asking, yeah, could this really be different? Do we really need to do it that way anymore? And I think the answer is often no. Let's do it a better way.
And what's a theme that you think keeps coming up, either through this journey or just after this conversation, that we can focus on?
I would say it is, how do you get value? People are just afraid of being wrong for very good reason. And so, how do you build approaches that are based on a principle of trust but verify? That you have really good systems, not just to do work, but to like keep the human in the loop seamlessly. Just having that core principle of trust but verify is what allows you to move forward, like to move fast without breaking things.
Anything we haven't covered that you would like to address?
No, this has been great. Thank you.
Well, thank you.